Lawmakers in the Massachusetts House are expected to vote this week on legislation, and Ed just talked about it a few minutes ago, that would ban social media use for kids or children, teenagers under the age of 14, and implement statewide restrictions on cell phones in our schools. There's a lot of concern right now about kids and social media and what it's doing to their mental health, but is this the right thing to do? Joining us now, Dr. Erica Lee from Boston Children's Hospital.
Hey, Dr. Lee, it's always great to see you. So let's start right there. Do you think bans like these will actually help address the concerns about young people's mental health?
Yeah, I can really appreciate this push for stronger boundaries in general on children's screen time, obviously, especially in school. But I think the kind of important question behind that is what exactly we're trying to accomplish, right? So, for example, are we trying to ensure kids are able to focus in class? Are we trying to reduce overall time on screens? Are we trying to encourage their use of technology in ways that are beneficial to them? Are we trying to limit social media access during the day? There's probably not one size fits all. So what are the different ways to do that? And how can we also ensure, of course, that we're teaching kids digital literacy? Help them understand, how do we safely and effectively use technology? Why is it that you want to use different apps and games? How do you successfully navigate an increasingly electronic world? Because it's not going to go away anytime soon.
From a pediatric perspective, how does social media use impact developing brains and emotional well-being?
Yeah, an important consideration is the age at which kids are using screens, which is exactly what you're pointing to, right? So when kids are young, for example, they're learning all the time based on real world experience. So less interaction with what's happening in their actual physical world around them will impact, their learning, their social connection. As they get older, are they engaging in active ways with their environment? Right? Are they learning how to get along with kids on the playground rather than just watching what they're doing on a screen, or only interacting with kids through technology? Yeah. Do they know how to respond to something like boredom outside of just zoning out on, from doom scrolling or using social media? These are all important considerations for kids.
And Dr. Lee, let me drill down on what you're just talking about. Is there a certain age where kids are better equipped to make those decisions on their own? In other words, this bill they're talking about is 14. Can you, like you said earlier, is there a one size fits all?
This is one of the most common questions I hear from parents, so I really appreciate you asking me it. I wish it was as straightforward as at X age, every child is ready to take ownership over their screen time, right? But it really does matter how developed or mature your child is. How are they with paying attention and their emotion regulation? Do they understand how to use technology safely, as I said before? What are they actually doing with their screen time? Because not every kid is using screens the same way. It also does matter what their vulnerabilities are, right? So we know that kids who have difficulty with screen time tend to be more likely are the kids who have things like depression, anxiety, ADHD. So families really do have to individualize these decisions to their family and to their kid. And as I always tell you, we want to balance time on a phone with time for other essential things. So live interaction with other people, sleep, meals, exercise, school. We don't want anything with screen time to be at the exclusion of those things.
Yeah. No, ever. Yeah. All right, Dr. Lee, thank you so much. We appreciate it.
Thanks, Dr. Lee.